Welcome to the Power of One. Today, I am going to be speaking with an amazing doctor. And I wanted her on because December 1st is National AIDS Awareness Day. Welcome to the show, Doctor.
Thank you.
Dr. Tedaldi, you have been working with AIDS and HIV patients for many years. And December 1st, we celebrate the lives of those who have gone on because they had AIDS and there was no cure at that time. We have come such a long way to where people were taking a cocktail of pills, then down to maybe 2 pills a day. And now there are injections where they could take once every 2 months or something. Mm-hmm. Speak to the history of AIDS, where we came from and where we are today.
Well, that's quite a history because this is actually the 35th year anniversary of World AIDS Day.
Wow.
And in fact, the theme, I pulled it up before we started talking, is remember and commit. So I think your point about remembering where we've been, it's a 35-year history of starting with zero in terms of treatment, and even understanding what this disease was, to where we are now. And I think each decade has brought not only the scientific discovery of what causes it, but how best to treat it. And then fortunately, in that 35-year history, we now have very effective therapies. But we are still back 35 years ago with a lot of other considerations. And that, unfortunately, is still stigma, access to care, understanding how HIV actually has come to be in many communities and why it's disproportionately present in certain communities. A lot of what we call the social determinants that can contribute to increased rates, but also the challenges with access to care and effective success in remaining controlled. But yeah, it's a lot to go over. There's that you could include.
In that 35 years. So in that 35 years, and with the progression of the great medicines today, is HIV/AIDS a public health crisis?
Yeah, it has been from the beginning. And I think in part because you have still probably about 1 in 8 people who don't realize they have it. There is an attempt to get, part of the U.S. strategy is increasing testing. So whatever opportunity where someone would come into healthcare to get tested, community-based testing, but there's still a fair number of people who are unaware and therefore at risk for their own health, but transmission. So there's still, thousands of people who are newly infected every year. And there's very effective, when you're talking about the history, in the 35 years, we now have effective prevention treatment, but the uptake of that is very low, what we call PrEP, pre-exposure prophylaxis. Mm-hmm. And for a variety of reasons, people perceiving that they might be at risk, even though they're sexually active or maybe, engaged in other behaviors. But again, access to healthcare, not really having great faith in the medical system or wanting to take meds when I'm fine. Why should I take something to prevent an illness when I'm doing, fine? And so there, as well as coverage. And unfortunately now politically, we're almost seeing attempts to roll back the successes of the 35 years, states saying they won't cover PrEP and things like that, which is, so we will have much more of a public health crisis if we don't really use the tools that we have available right now.
Now, so when AIDS first was coming among us, mm-hmm. the numbers were high. So did they ever dip or go low, or we're still dealing with a great amount of people who are diagnosed and who are living with AIDS?
Oh, well, one, the numbers are going down, definitely. And certainly the mortality associated with HIV has plummeted, because people can get effective medication. But you're still seeing, somewhere 20,000 plus per year of newly diagnosed patients. So it is, a lot of people, when you talk about it, they say, well, isn't that something from the past? Or,
Mm-hmm.
it barely crosses their mind that it's still something that's an active problem, but it is. It's still, we've had, you can look at major successes. The introduction of medication. We now rarely have children born who are infected with HIV, because we know from many clinical trials that if we treat a pregnant woman, she is not going to pass it on to her infant.
Mm-hmm.
So that has been taken up. The gynecologists and obstetricians now have that as part of their routine. So as long as, again, someone accesses care, gets prenatal care, they're going to do fine. But we still, we're dealing with, there's another public health crisis, maternal mortality. And some of that we see in women who don't get to access services and may find out when they're pregnant that in fact they have HIV. So it is still very much a public health crisis. And part of it is not helped by attempts to decrease funding for it here and internationally.
Mm. Okay. Now, the screening for AIDS, HIV, has that changed over the years?
Mm-hmm. Yes. It used to be a 2-part test that could take days to come back. Now you have that most of the blood work that is done is called a 4th generation. So it can very rapidly tell you within hours whether you are HIV infected, as well as also picking up people who may be newly infected based on the way these test results come out. So we're able to pick up people who may have been infected within 2 weeks of their exposure, which is a major breakthrough in testing. We also have some rapid, what we call point of care. So you may go to community testing and they may do a finger stick like they do for blood sugar. And that's another way to do, rapid testing. And it's recommended for anyone between 15 and, they say 65, I say 15 till death. You can get that as part of your routine healthcare. And it's considered what we call a grade A screening. So all of the public health services recommend it for everybody.
And doing research, I did see that there were over, or maybe 32 million people who had HIV, and that was from when it was first diagnosed. Do we still have, and I think you touched on this, many people who die from AIDS? And doing my research, and you can speak to both of these, and doing my research even further, I found that there were a lot of older adults that have AIDS. So we're talking about our seniors. So they have AIDS and they may have heart failure. They have AIDS and they may have lung disease. How does that impact one another, and will that result in an untimely death?
Yeah, well, you bring up a good point, because there's deaths that are related directly to HIV, and those are certain infections or cancers. Fortunately, those are less common, but we still see people who come in very advanced and will die of an HIV-related cause. What we are seeing more often is, in fact, people who are dying of what's called non-HIV related, but HIV is a contributing factor for heart disease, cancer. So because even though we control HIV, our immune system is still chugging along in the background, causing inflammation and other changes. So you see like twice the rate of heart disease among people living with HIV as compared to someone who doesn't have it. So all the more reason that, you need to treat both, the HIV and the non-HIV. And with regards to seniors, yeah, we especially, I'm trying to think if we, at least in our practice, see more women identified. Again, because I think what is missing in the screening, getting back to screening, is perceiving that someone's not at risk. So, people go to a physician or to a healthcare worker, they may not get a sexual history. They just assume, oh, this is someone older, they may or may not be sexually active. Well, you got to ask. If you don't ask, you don't know. And,
Right.
or it might have been from an exposure years ago, and they've never been screened or had an occasion to get tested. We find that not infrequently, that people never, were just thought not to be at risk. And indeed, they may have been in their past or recently.
Now, having AIDS, HIV, it requires attention daily. Do you know, and I don't know if you know the answer to this question, if someone does not have any life insurance and they have to go to the free clinic, do you think that the free clinic is very attentive to the needs of those who have AIDS and staying up on their medication? Because, we think free clinic and we're thinking like, oh my goodness, they're not going to be able to tend to my needs or give me the medications that I need. We just think it's bad, you know what I mean? Because it's a free clinic. Can you speak to that? Do you know anything about that?
Oh, yeah. No, when you're talking about in the 35 years, probably the major public health intervention that occurred is something called the Ryan White Care Act in 1990, named after a young boy who died of HIV related complications. And in the United States, if you have HIV, every state provides you with access to medications. So you should never go without medications. Under this Care Act, there's funding for what are known as Ryan White clinics, or even in academic centers, they may receive funding so that no one should go without medications. Every state has a drug assistance program. So even without insurance, you can submit an application and get your medication. So no one should go without services, or no one should go without medication. And part of it is sort of knowing where to go. If, like here in Philadelphia, if you go to one of the health districts, they're very savvy and familiar with it. And they usually either have someone that may come into the clinic to treat it, or they can, refer to the many practices around town that do HIV and primary care. Because that's the other thing is, and usually having HIV, because you need life-sustaining medications, that this also may enable you to get insurance, which, may or may not have been the case if you didn't have a major health condition. So no one should go without medication or treatment.
Now, being diagnosed with AIDS or HIV is not a death sentence. Getting the proper medications, one can live a long life.
Yes. Yeah. No, that is what we tell patients when they're coming in the first day and they're very frightened because they have it all in their background. I'm going to die. And we say, no, as long as you are, if we work together as a team, you're able to take your medications. We'll provide what support. And again, through these programs, there may be some additional supports to provide patients. Usually some of the main issues that we deal with that may affect your ability to live a long life are cigarette smoking and ongoing substance use. Not a surprise. Those are things that would shorten your life, but certainly if you're taking medication and still smoking and still using drugs, then you may not necessarily have that promise of a very long life. But otherwise, yeah, you take the medication, you should be okay. And one of the things that I think, I'm sorry, real quick, is an advantage, and especially for some of our younger patients, is because you're now in care, you may have never entered into care until you got older and had conditions that were more advanced. Now
Mhm.
you're coming in and, you stop by twice a year. We'll give you your vaccinations. We'll check you for cholesterol, diabetes, whatever. So you may get, sort of better care because you're being monitored. Whereas before you might not have ever showed up to see the healthcare provider.
Now, break down for all of the viewers exactly what AIDS is, and then speak about the medicine and how it treats, because AIDS is not curable, correct?
Not yet.
Okay, so speak to actually what AIDS is and the medicine and what it does to treat the AIDS in your system.
The HIV, yeah. Well, AIDS is the sort of overall condition when human immunodeficiency virus, or HIV, gets to a certain point. So it specifies when this virus, it's called a retrovirus, gets into your system, and over time, if untreated, what it does is it lowers your immune defenses. So it puts you at risk for certain infections, what we call opportunistic infections, or certain cancers. And with the way the medicine works, you're right, we don't have the cure yet, but it works on different parts of the virus's life, what we call their cellular life. So it really just sort of, if you imagine it like a factory making lots of little virus particles, it shuts it down. It works on all the different parts of that cell's life to make it stop growing. So it eventually just what we call suppresses. And then what you're looking for is a point where there's no more virus being produced, that we call being undetectable. So it really is providing medication to prevent the virus from growing. If you stop it, the virus can just come right back because you haven't cured it. It's still hiding, but the medicine keeps it under control.
Without medication, what does AIDS actually do to your body? And we're going back years ago. What did it actually do to your body to where people were dying so quick? And you know what I mean? They probably had it for years, but then when they came to the doctors, it was like probably too late. But what does AIDS do to your body to where it caused death?
Over time, this virus causes you to lose a certain white blood cell called a CD4 cell or T cell. That cell is very important in your body's immune system to fight off certain infections. So you would be dying of these opportunistic infections. So cryptococcal meningitis, toxoplasmosis, pneumonias, pneumocystis pneumonia. These are some of the more common opportunistic infections. So over time, your body just loses its ability to fight off these infections. The cancers are usually because of other viruses that you have in your body, like Epstein-Barr, which is mononucleosis, or papillomavirus, like cervical cancer, or other types of cancer. So they work together. When your immune system is low and you don't have these CD4 cells anymore, you basically can't fight off these infections. And it's the complications of the infections or the cancer that people used to die of. And then you could treat those particular infections, but without treating the underlying immune problem, you were still at risk for dying.
Dr. Tedaldi, I want to thank you for your many years of service. Thank you for loving on people that other people did not want to interact with because of their ignorance and because of their lack of knowledge. So how do you feel being around for this period and all of the advancements that have been made and all of the accomplishments that you've seen over the years? How does this make you feel coming up on 35 years?
It can be pretty amazing. And when I first started working as a physician in New York, I mean, I would have people come into my office and they would be gone within a couple of weeks. Now they come in and I say, I may have some bad news to share with you because we diagnose you, but here I have a pill, literally a pill I can give you, and you'll do fine, and you can plan to live for. So it's such an amazing experience to see the evolution in a really a very short time. And it's, yeah, I think it's a tribute to the combined work of not just the science, but I think also the community, because that's extremely important in terms of getting the word out, and also taking the leap of faith that this is going to work. Yeah, no, I have been very fortunate, and I have patients now that are grandparents. I met them when they were teenagers, and
Oh,
so
wow.
yeah, so it's pretty amazing. I mean, I think any physician would tell you, having a in primary care anyway, a long-term relationship has tremendous rewards. But to see people who were told 20 or 30 years ago that they really may not live long, and now they're coming in with all the aches and pains for all of us as we get older.
Well, again, I thank you. And you still have a lot of work to do. So don't think about going anywhere anytime soon. But
Yeah.
I thank you. I am sure your patients thank you, and their family members thank you. You have done amazing, amazing work. Thank you so much.
Oh, you're welcome. But it was a team. It's always been a team working on this. So thank you.
On December 1st, we take a stand to educate those on AIDS and HIV. On December 1st, we will stand for a moment of silence for all of those who have gone on before us, who suffered from AIDS and HIV. It is important to educate yourself, not to isolate anyone or to treat anyone bad. We need to love on one another. Remember, the power of one starts with you. Peace and love.